horizontally along the bikini line, a few centimetres above the pubic hairline. A horizontal incision is performed most commonly because there is less pain after the procedure and the wound heals very well. Occasionally, a vertical or midline incision is required if the caesarean section is likely to be complicated. After the abdominal cavity is entered, an incision, a cut, is made in the uterus. Usually the incision is horizontal or transverse. Once the uterus has been cut, the amniotic fluid around the baby, starts to drain. You may notice a sucking or slurping noise as the amniotic fluid is being sucked away from the operating field. The baby is usually delivered head first. Forceps are sometimes needed to assist with the delivery of the head. If the baby is presenting breech, the baby will be delivered bottom first. With twins, the baby who has been coming first will usually be delivered first. Once the baby is born, the umbilical cord will be clamped and cut. You will be able to see your baby as soon as he or she is born. The midwife or pediatrician will then place your baby on the resuscitation trolley to dry your baby, ensure your baby is breathing normally, ensure your baby has a good colour and heart rate, trim the cord close to the umbilicus, give your baby vitamin K if you have given your approval. Your partner or support person may be able to join your baby at this time. Your baby will be wrapped up to keep warm and brought over to you to hold. Depending on the effects of the anaesthetic, you may need some help to hold your baby. You may have some skin-to-skin contact at this time. Shortly after this, your baby will usually be transferred to the postnatal ward, accompanied by your partner or support person. In some cases, your baby may be able to stay with you and accompany you to the recovery room. The placenta is removed and the uterus checked to ensure it is empty. The uterus and abdominal wall layers are closed with dissolving sutures, and then the skin closed with sutures or staples. A clean dressing is applied over the wound, and you will then be transferred to the recovery room. Observations will be taken of your blood loss, blood pressure, pulse, and temperature for a further 30 to 60 minutes. You may experience some cramps during this time or experience some nausea. The staff in the recovery room can give you medications for this if needed. Your legs will be numb for several hours after a regional anaesthetic. You will leave the recovery room to be with your baby in the postnatal ward when your observations are confirmed to be stable and you are comfortable.